My name is Johan Vos. I'm the Deputy Executive Director of Alzheimer's Disease International. My role is obviously to deputize for our Executive Director, but we also have specific areas where we focus on in the world. So I look after predominantly the region of the Americas and also of Africa as well, and work with the regional World Health Organization to influence the dementia agenda. And of course I deputize whenever required when our Executive Director is not there. Yeah, Alzheimer's Disease International was established about 30 years ago by 4 of our members, and really the purpose was to influence the global health agenda and also to strengthen our member associations, which have grown now from the original 4 or 5 that started it to 83 members across the world. And strength is in numbers, so the more members we have, the stronger our voice is. Our members predominantly work in their countries to help and strengthen the support infrastructure and also work with their governments to, on a national level, to put dementia on the agenda and to get their governments to take more action. And from our part, we support our members in that endeavor, but also work globally with the World Health Organization, the United Nations, the OECD, all the global health agencies that we work with closely. And for instance, with the World Health Organization, we have consultative status, so we have opportunities to be at meetings and to also provide feedback. One of our main aims for Alzheimer's Disease International is for governments to make dementia a national health priority. That is important because Alzheimer's is a disease that is growing. It's as a result of an aging population. So at the moment we have about 48 million people with dementia, and by 2050 that will increase to 131 million people. So that's a huge increase, and also the cost as well. The cost of Alzheimer's worldwide, globally, is 818 billion US dollars, and that will soon get to 1 trillion in 2018 and even 2 trillion by 2030. So you can imagine that there's huge challenges for governments to take action and do something, because if they don't, it will cripple their health systems. So one of our key advocacy platforms is to say that every country should have a national dementia plan. Now, the UK has got one such plan, and also other countries. In fact, Australia was the first country to have a national dementia plan. And now I'm pleased to say that at least 20 odd countries have such a plan. And such a plan means that those countries are better prepared for the dementia epidemic, because it will cost an enormous amount of money and it will require good care, and that's what those plans will help ensure. So that's one thing. And the other thing is we also try to strengthen our member associations as well, because stronger members means that they can be more effective in their roles within their country. And the other thing that we do is we also encourage more research, because as much as we believe that we must do our best to care for people with dementia and their carers, through a very cruel and horrible disease, we must also firmly keep our eyes on finding a cure. We believe that there's not enough money going into research for dementia, and we would really like to see that upscaled substantially to about 1% of the total global cost of dementia. So we would like to see that increase to about 8 billion US this year. The report tells us that the cost of dementia, as I mentioned before, is quite large, and I think that has woken up a lot of governments as well. We have even broken that down to country level, so where required we can give this information by country, and have done so. Because as much as we like to work with governments around the world and help them come with solutions, part of that solution is also stating the fact as the situation is currently. So that's why this report from King's College in London is extremely valuable. It's also valuable because of the prevalence of dementia. So prevalence is increasing, and roughly it's doubling every 20 years. But in some regions of the world, like for instance in Africa, the prevalence is quadrupling. So that's a result of an aging population and basically people living longer and healthier. It's a result of improvements in health systems, and the consequence, good consequence, people living longer, but people living longer are also have a higher chance of developing dementia. So, so it's important to know that we need to address these issues. What is also comes out of the report is that most of dementia will occur in the lower and middle income countries. So roughly 2/3 of that will be in these countries. Although the cost of dementia, as I alluded to earlier, that happens in most of the high-income countries. But at Alzheimer's Disease International, we believe that finding solutions for high-income countries, but particularly for lower and middle-income countries, need to be practical and cost-effective as well. The other thing that came out of the report, that we also need to pay attention to risk reduction strategies, make people aware of some of the risk factors around dementia, and they include smoking, hypertension, diabetes, and so forth. So it's really important that governments also invest in a public education program and make people aware of the risks of dementia and how they can try to mitigate against that. Well, what we hope is that it helps us having a conversation. So it helps us having a conversation around the World Health Organization and the UN, so they take stronger action and come up with resolutions that will mandate governments or member states around the world to do something about it. And at the national level, through the work with our member associations, it will help them to have those conversations at the national level with their governments as well, and to articulate the case for support to do more for people affected by dementia in these countries. And some of the countries that we work with, like for instance countries in Africa, dementia is not even on the radar, but the stigma is very big in those countries. For instance, in countries like Ghana in Africa, people are treated in the most horrible ways. There are witch camps in Ghana where obviously women who family members believe that they are acting strange, and they banish them from their family and even take them to those camps where they are treated in the most inhumane way. So we also believe that dementia is a rights issue as well, that people with dementia deserve around the world to be treated with respect, with dignity, and that is what we're working on as well, to make it a rights issue globally.